when people are hired here, they're trained, they're here 9, 10 years, and then all of a sudden they know down the street that they can go to a department up there or a department down there and get better benefits and get paid. So now they're losing a 10-year vet or a 20-year vet. That's the problem. That the retention, we're doing actually a pay study that includes the cost of retention and stuff like that. So if you put all that together on an average of $25,000, you talk about 10 guys, that's $250,000 that they're losing. Not to mention the experience, because in the fire service, we need those experienced guys to help us learn. When I was a probie up in Chicago, it's the same thing. They taught us how to see a fire, how to go into a fire, how to hear fires, how to hear buildings that are starting to give way. And the main problem is when the retirees know that they won't be taken care of, why would they stick around? This is just for the retired guys who've already been told, promised that you're going to have health and we're going to help you or assist in your health care and pay for it until you're eligible for Medicare. Well, now all of a sudden an agreement, a promise that they made, and one of the reasons why these retirees stuck around here is knowing this fact. Well, now they're pulling the rug under us.
My name's Chris Collins. I retired from the fire department in the city of Myrtle Beach. The numbers about the health care, for me personally, right now, out of my retirement check, is 26% of my salary goes to pay my health insurance benefits. I met with the agency that they asked us to meet with 2 weeks ago, and it's going to be 57% of my salary if I take the government subsidy. Without the government subsidy, my health insurance is going to be $220 more than I make a month in retirement.
So you're paying in for these benefits, and now they're denying those benefits once you retire?
Yes, we paid in our entire career, and there's a bank of money set aside for the retirees now to pay our health insurance benefits. And with this new system they're asking us to go to, we won't have access to that money until we hit Medicare. I retired at 45 years old, so I've got to wait till I'm 65 to access that money now. That's not fair. That's not right.
We're told that currently the city government is well understaffed in all areas, not just. Do you think this broken faith, this broken promise, is why they're having such a hard time finding new people to come and work in this town?
I would imagine it's a retention problem. A lot of people want to come to Myrtle Beach. It's a beautiful place. We've got the beach, we've got the weather, but you get here, excuse me, I'm from here. So I was born and raised here. I'm not going to leave. So a lot of people come in, they see what's offered, and it's not a year, 6 months, 5 years. They find something better, and they get their training here and they move on. And I don't blame them. In addition to what you were saying, the city has a clinic for all city employees that is free health care. We go in, we have doctors, nurse practitioners. Our common medications are filled free of charge. The insurance company has worked out so that we get discounted MRIs, x-rays, emergency room visits, surgeries, and we're going to lose all of that now. So in addition to the premiums I'm going to have to pay, now I'm going to have to pay inflated costs for every service that I get for me and my family.
Still about our original problem for lifetime.
Are you considering now picking up another job, although you retired? I mean, is that in a thought process, maybe picking up another job to be able to handle Medicaid?
It's a double-edged sword. I knew when I retired at such a young age that I was going to have to work because the retirement is not a living wage. And that's just the fact, working for the government. I have enough time, but because of the way they're structuring the new insurance policies, if you have a job, it's based on your income. So the more income you make, the more insurance you're going to have to pay. Even though we did our time with the city, we gave our bodies to the city. The only thing we're asking for is just the benefits that we were promised in the beginning, which they've already changed. When most of us were hired, we had benefits for life when you retired. In 2009, the city changed it from benefits for life to we're going to give you $100,000 to pay for your portion. We still have to pay for our families in addition to, but for my portion, the $100,000 that the city set aside pays for mine. I'm already halfway through it at 52 years old. So it's just getting harder and harder for these guys. Most people in the fire service, that's a young man's game. Guys retire out 45, 50 years old. and you don't get Medicare till 65, you've got to fill in the gap somewhere. So unless you retire out medically, you're in trouble.
You mentioned your family. Can you talk about the additional strain that it puts on your kids, your wife, anyone else under your health care that may have other issues aside from health?
Well, for me personally, I have a wife and 2 kids still on the plan. My oldest daughter's aged out of it now. So we have to, I'm sorry. Now my doctor is the city clinic. My wife's doctor, my son's doctor, other than his pediatrician, it's the city clinic. So now we're going to have to find new doctors, establish new relationships, go through our entire history, where we've been, how we got here, and all this. So it's just another step in the process that's not going to be comfortable.
By show of hands, how many of you folks took this job because you believe the benefits were a key ingredient in the package? Wow.
That's
You don't do it for the money.
Right.
You don't do it for the money.
Wow.
You do it like what I said is we do it because we're going to be taken care of and our family is afterwards.
So, next slide. So, as group benefits, we lose the ability to say, here's my insurance card, I'm an employee with the city of Myrtle Beach, or I'm retired from the city of Myrtle Beach. When I bought to doctors and hospitals with any care whatsoever, it's like having that golden ticket. It means so much more than going in with a different account. There's inflated deductibles on the different programs that they have. It provides an unfair cost to us, and it doesn't include dental or medical. Dental and vision. We lose our MRI scan to $50. And the big cost that I can't see us losing is the city clinic. Next one, please. So there's a little bit of loss of integrity. I know you serve with honor and integrity, but when we look at what we're doing to our employees, retired, or those getting ready to retire, or those going through the system, you lose a little bit of that. A lot. If you're cutting the retired people that have served in this community, and when you look at the group that I got to serve with, I'm astounded about the dedication and the heart that they gave to the city. So it's going to cost the city our non-competitive hiring market, publicity. This is what I want to go to more. So next slide, please. We just commemorated September 11th. And the police and firefighter careers span unique physical and psychological stresses that are not normally associated with any other occupation. We are prone to lifelong injuries and illnesses, cancers, and PTSD. Lifespans are shortened. At times it's like a war zone activities, and apparently the city wants to leave those that serve and put their life on the line and leave us behind enemy lines unprotected. Sounds kind of familiar to that. This is no different than defunding the police or lack of support to the firefighters and police officers. I'll pause there just to say thank you for all the support that you have given to the fire departments and the police departments and the parks, all the departments in the city. I truly believe that you have that at your heart. But this is defunding us after we provide our sacrifices, because our bodies and the taxations that we do cause injury and illnesses that go far beyond to shorten our careers. So that's why we need it so importantly in our retirement years. This isn't meant to lessen the value of other city occupations, but embraces each other. It takes every city department from finances to public works to HR and administration, including recreation. We have all come together whenever and wherever the city needed us. Whether it was a hurricane or a bike week, we were there. Special events. All the departments, it's a beautiful thing to see what happens with this city when we all come together and do those things. Imagine today, if somebody were to go into the military and say they're going to put their life on today, on the line, and at the end of their career, in the police department, fire department, or anything, they don't have any VA benefits when they were to retire. So when they come on, they don't have $100,000 or $50,000. All right, the last one, or getting close to the last one. The city clinic costs money. That's a fact. But it's designed to save the city money. It saves us in so many ways. You get pricing. You get so many benefits out of it. It saves on time just getting into the appointments. It's not overtaxed. Your prescriptions are covered. But more importantly, we have that doctor-patient relationship. They've been viewed over so many years with those, the doctors and the nurses in there. It takes years to foster that. You take this away from us, we're going to end up at doctors' cares and places like that that don't have that relationship, that don't know us, that don't have a clue about how to treat us. So don't increase the cost of any insurance, because almost every time we've had an increase in pay in the past now, in the long range, the insurance has increased to offset the pay raise. Don't drop the older group off the insurance. It's nothing short of discrimination unless it's our integrity. Expenses are rising all around us, and insurance companies want us off as well. It's beneficial for an insurance company to abandon the older generation because their profit margin goes up. The insurance companies don't lose money, trust me. My total Social Security money covers my true insurance costs. So we are accountable. Everybody's accountable for what we do. That's the way we operate in the city. That's where our pride comes from. And insurance advisors that spoke today, they're accountable. Our mayor is accountable. City council is accountable. City management and staff. So when I ask this question, it's with all due respect, and thank you for the time, is what kind of person would do this? Do they represent the standard of employee you would want to hire to represent you? Don't remove the retirees for future, or the future retirees from the all earned benefits they earn. And please do not price us out of the market. Keep your integrity, and please hold those accountable, because when we had our meeting, when the city clinic came up, it was, well, we thought about that, but it was said to just go ahead and rip the Band-Aid off. And I will tell you, we are united, and we're together, and we all love the city of Myrtle Beach. We love working for you, and thank you for your time and what you do.